Namaste. Today, welcome to our patient awareness programs. Today, we are discussing lot of topics in every day. Today, we are discussing about atrial fibrillation. Myself, Dr. Rufus Dimal, I am a cardiologist in the Department of Cardiology in Apollo Hospital, Jubilee, Hyderabad. Today, we have a very important person who is not only a cardiologist, who has specialized in the conductive system of the heart, who is called as an electrophysiologist. Today we welcome Dr. Soumen Devidutta with us to elaborate on some of the common factors which the people are facing. Welcome, Dr. Soumen.
Thank you, Rufus. Thank you. Namaste. Namaste to our viewers. Thanks, Rufus, for the kind introduction. So, as Rufus pointed out, I am a cardiac electrophysiologist, which means I am a cardiologist, all right, but I focus on cardiac rhythm disorders. So, the disorders which connect with beating irregularities of the heart, or heartbeat or heart rhythm problems. So, our population or cardiac electrophysiologists deal with cardiac rhythm problems or cardiac arrhythmias.
There are a lot of things in the rhythm problem to discuss. But today I think, Doctor, can we discuss about atrial fibrillation?
Sure. I think it's a very common problem, and a lot of our patients have a lot of doubts about atrial fibrillation. So it's probably important for us to have a session and try to connect.
So can you tell the common people in their common language, what is atrial fibrillation?
Atrial fibrillation, for starters, it's a cardiac rhythm abnormality or a disease of cardiac rhythm system. We technically call it cardiac arrhythmias, as we know, Rufus. To understand what atrial fibrillation is, I think we must have a little basic idea of what cardiac contraction or how cardiac pump function happens, and how the electrical system of the heart is closely married to cardiac mechanical function. Now, to have a very basic understanding, heart is not it's not a simple pump. It's a complex organ with 4 different chambers. There are a group of upper chambers, and there's a group of lower chambers. And this very complicated or sophisticated pump function happens in a very synchronous and very beautifully coordinated manner. Now, if you closely look at my fists, my left fist represents the upper chambers, and the right fist represents the lower chambers. In normal scheme of things, we have a very tightly coordinated or a synchronous function of these 2 chambers. Now, please focus on my fists if you can. Notice that as the upper chamber squeezes, the lower chamber relaxes. Now, this allows all the blood that the upper chamber squeezes to be emptied into the lower chamber. And in return, when the lower chamber squeezes, the upper chamber relaxes. That allows the fresh blood from the periphery to come into the upper chambers. Now, this sounds simple, but this is a very sophisticated task which coordinates all the 4 chambers in a beautiful manner. And these chambers work in tandem to optimize the heart's mechanical function. Now, this difficult task is done by the cardiac electrical circuit, which is a very sophisticated system. We can't go into the details of it. But this is where things go wrong in atrial fibrillation, or for that matter, any cardiac arrhythmia. In atrial fibrillation, fundamentally what happens is the upper chamber goes into a very chaotic and irregular rhythm, where the mechanical function of the upper chamber is completely lost. So the upper chamber is no longer contracting, it is just in a standstill. Whereas the lower chamber is fast and irregular. So now there are 2 things which are fundamentally gone wrong. The marriage between the upper and lower chambers, or the coordination, the synchrony that we were talking about, is lost. Second, the upper lower chamber is rather beating at a very fast and irregular manner, and both these factors take the rhythm or the mechanical function away from the fundamental synchrony that we had. Now, this reduces the pump efficacy significantly, and overall the circulation suffers, leading on to symptoms of atrial fibrillation. That, in short, is atrial fibrillation.
So basically a family which is comprised of husband and wife, where coordination is lost.
Yeah, exactly.
Okay. So moving forward, is it so common in the general population, doctor?
It is. Actually, atrial fibrillation is among the commonest arrhythmias that we deal with. I'm sure any cardiologist, or in fact senior physicians for that matter, routinely come across atrial fibrillation in our clinical practice, in patient practice. So it's a very, very common arrhythmia. Yes.
Okay. And is it that as the age advances, the frequency also increases?
Yes, Rufus. Atrial fibrillation is quite closely coupled with age. So age is a non-modifiable risk factor. As we say this, as we are all aging, we are increasing our chances to have atrial fibrillation in our lives. So for example, if somebody who's in the bracket of 60 to 70 years of age is probably about 5% risk of atrial fibrillation, and as you go from 70 to 80 bracket and 80 to 90 bracket, you probably have a 20% chance of atrial fibrillation. That said, apart from age, there are some other risk factors which are patient dependent or patient adopted risk factors because of the lifestyle. They include uncontrolled hypertension, poor attention to diabetes, obesity and overweight and its related complications like sleep apnea. We all deal with sleep apnea. We know what are its ill effects. It's such an underrated and undertreated entity. Then people who have old heart attacks and weak hearts because of those heart attacks, LV dysfunctions, mechanical heart failures, cardiomyopathies like hypertrophic cardiomyopathy and so on. All these factors, when come together, they make these patients prone for atrial fibrillation at some point in their lives. Apart from that, if you take a younger group of patients, they have these valve problems, especially mitral valve, which is a structure between the left upper and left lower chamber. When we have structurally significant defects of the mitral valve, these patients often have a tendency to have atrial fibrillation, and these atrial fibrillations are the most vicious and most stubborn kind of atrial fibrillation to deal with. So these are all overall, again, thyroid, patients who have thyroid problems, metabolic problems like hypothyroidism or hyperthyroidism, they are also at the risk of atrial fibrillation. In younger people, the rarer causes are excessive alcohol usage can lead to atrial fibrillation. And severe stress and sleeplessness also, I have seen many patients who have atrial fibrillation with these kind of problems, although they are reversible. So these are overall the risks.
So Dr. Soumen, do you think the viral illnesses like what we had, COVID, has increased atrial fibrillation?
Yes, very good question, Rufus. I think we do notice not only atrial fibrillations, a variety of cardiac arrhythmias have been noted in the post-COVID era. In fact, we haven't seen those kind of arrhythmias. So clearly there is some sort of association with the post-viral myocarditis, atrial or ventricular, leading to a barrage of cardiac arrhythmias, including atrial fibrillation. So yes.
So do you think what are the symptoms the patients are going to have with atrial fibrillation?
Yeah, so the symptoms that patients suffer with atrial fibrillation, they're not constant, they are highly variable. The commonest symptoms that they suffer with is shortness of breath or breathing difficulty, extreme fatigability. In fact, some people feel so sick that they just can't walk, lightheadedness, giddiness, and sometimes people even black out. So overall, these again, some symptoms, some patients just come with a complaint of not feeling well, feeling of unwell, or vague feeling of chest discomfort, squeezing. So these are some overall common complaints that we hear. We use this term exercise intolerance or effort intolerance, which is not specific for atrial fibrillation, which means that this patient who was earlier able to do some physical activities or day-to-day activities without any difficulty, once they have atrial fibrillation, they start having more difficulties. They just can't carry out those physical tasks without difficulty. They stop and pause because of breathing difficulty or shortness of breath. That said, patients who are young and who have more structurally preserved hearts, they tend to suffer less. They tolerate these symptoms better and have milder symptoms. However, some patients who are more aged or elderly or have significant structural disease, like somebody who has a cardiomyopathy, which is pre-existing, or a structural heart disease, suffer from these symptoms much more severely. And in fact, we have seen enough where they just have an atrial fibrillation, sick patients who have a pre-existing disease. They just become so sick they need a ventilator, they need a dialysis. These are not very common, but we see it quite frequently in our practice. So it depends on a lot of factors: age, patient's comorbid status, underlying heart disease, and so on and so forth.
So any stable patient with LV dysfunction suddenly deteriorating,
oh yes,
we can think of atrial fibrillation.
So, patients who are already suffering from heart failure or LV dysfunction, they may be apparently stable on medicines, but the moment they have atrial fibrillation, their balance is lost. It's like somebody is walking a tightrope and they just are tipped off and they just land up into a very bad heart failure episode and they need a hospitalization, like you pointed out.
Okay. So what is the main effect the atrial fibrillation is causing on the heart?
Yeah, a great question again. So atrial fibrillation is, we've already spoken about the symptoms that the patients experience. Second is atrial fibrillation at the same time, apart from the symptoms that it causes, it also makes the patients prone for a certain group of complications. Nothing more important than strokes. Now remember, I told you in atrial fibrillation the upper chamber is not contracting. There is no squeeze in the upper chamber, it's only the lower chamber which is contracting. Now we all know that when blood is a viscous liquid and it needs to keep flowing, the moment blood becomes stagnant or it becomes sluggish, it is prone to develop clots. Now when the upper chamber is not contracting, it's natural that the blood inside it is not swirling anymore, it's just becomes slow and sluggish, and that makes it very prone to develop clots and thrombi in pockets of the upper chamber.
Okay.
Now one such opportunistic clot can easily come out of the heart and go to brain, causing a catastrophic debilitating stroke, or it may go down to the limbs and cause an ischemic gangrene. It can go to the kidneys causing ischemic renal damage, or intestines. We've seen it all. And this complication is called an embolic phenomenon. Apart from the strokes, we've already just discussed that patients who have sick hearts, who have suffered from heart failure or previous heart attacks or cardiomyopathies, are prone to atrial fibrillation.
Okay.
Now once they develop atrial fibrillation, it's a very paradoxical relationship. When they develop atrial fibrillation, this atrial fibrillation actually makes the whole disease worse.
Okay.
So it's a cycle. So atrial fibrillation is caused by these diseases, and once atrial fibrillation is started, it makes the whole disease much more progressive, and a downhill course really starts, and these patients very quickly advance to an end stage unless atrial fibrillation is rapidly and quickly taken care of. So these are two additional things that I think patients must be mindful of.
Okay. In some of the young population, we have seen that patient has come with LV dysfunction.
Yeah.
Due to AF, and with your treatment, I have seen people who have becoming completely normal.
Yeah.
Can you highlight on that, sir?
Yeah, so again, a very pertinent point. It's not only atrial fibrillation. Somebody, when we lose normal rhythm and go into a cardiac arrhythmia or a rhythm disease, and somebody is at a fast rate all the time, there is something called tachycardiomyopathy or arrhythmia-related cardiomyopathy, which makes the heart over a long period in time. It could be weeks to months, when the hearts keep beating in a very irregular and fast manner, and they develop something called cardiomyopathy related to cardiac arrhythmia. And naturally, when we take care of the cardiac arrhythmia and treat it either with medical treatment or with any other procedure, and the rhythm is restored or normal rhythm is restored, the heart function starts recovering and comes back to normal. That's very commonly noted.
The important point to be noted is there is a cardiomyopathy. Many people think that it is irreversible. There are cardiomyopathy which can be treated, and we can reverse them into a normal patient also. That is the very important point to be noted. As you said, sir, the main effect you said, it is forming clots in the heart, and it is producing stroke. So how to prevent it, sir?
Yeah. So anybody who has atrial fibrillation and has a certain risk for stroke, they are all probably lifetime candidates for treatment to prevent stroke. So the commonest way we do it is we all do it routinely in our practice. We start them on a specific group of blood thinners called anticoagulants, not antiplatelets, which are given for patients to patients who have been stented. Now these anticoagulants are specifically directed to avoid or prevent clot formation in the upper chambers, and these patients, unless otherwise indicated, these patients are probably candidates for lifelong anticoagulant treatment. Now some patients are not candidates for anticoagulation because their blood is thin, they have had bleeding issues in the past, or they have had tendencies to bleed, life-threatening bleeds. So in such patients, which is a small group of patients, we actually do a small procedure called LA appendage occlusion, where we actually go into the heart, not through a surgery, but an interventional procedure like an angioplasty, where the pockets in the upper chamber, like I mentioned, are closed with some cap-like things, where they are completely closed, and that basically negates the tendency to form clots inside the upper chamber. So these are essentially the two ways by which patients can avoid strokes or clot formation in their hearts.
Yeah, as you said, the clot formation is producing stroke. So the general question the people will have is this: the clot will produce heart attack also, or is it vice versa?
Yeah, again, great question. We often hear this question in the atrial. The straightforward answer to this question is no. Atrial fibrillation does not have anything directly to do with heart attack or heart attack with atrial fibrillation. Yes, patients who have had heart attacks in the past and have heart failure or heart muscle weakness because of that have a tendency or can in the future go on to have an atrial fibrillation. It's a risk factor, but that heart attack doesn't directly lead to an atrial fibrillation, and the reverse is also true. Atrial fibrillation is a specific rhythm problem, and that does not lead on to a heart attack under normal circumstances.
Okay. Probably a small group of people, the thrombus can, if they are unlucky.
Yes. So
the
and it's a very freak incident where a clot can go into the coronary arteries and can cause a heart attack, but it's a very, very rare event, as you said.
Good. And the other thing is, you said what are the treatment to prevent stroke. Now, what is the treatment to cure AF?
Yeah. See, Rufus, great question again. Atrial fibrillation, the best that we can do for atrial fibrillation is to cure atrial fibrillation rather than just allow atrial fibrillation to damage the heart. The best thing would be to cure atrial fibrillation. Like any other field, we have conservative means, which is treatment with pharmaceutical drugs, and then we have a little more proactive means, which are interventional or catheter based procedures. We always start, like any other disease, with medical treatment, and there are a lot of drugs which are effective in people who have normal hearts, people who have structural heart disease. However, not all patients who have atrial fibrillation respond well to medical treatment. There is a certain group, which is a significant minority, who either do not respond at all or do not respond completely. They still have residual symptoms and they need something more to, and some people may not just tolerate medical treatment, they have a lot of side effects. Now, in those group of patients, we have an elegant modality which is called catheter ablation. We have seen it and done it quite frequently. Now, this is like any field of science or cardiology, the last decade has seen almost a meteoric advancement in the field of catheter ablation and mapping techniques. So now we have 3D ablation techniques. We have very sophisticated, refined catheters with advanced mapping techniques where we can map the atrial fibrillation using catheter-based techniques, using the groin. Now, it's just like an angioplasty. Now, people connect with angioplasty and stenting. This is just like an angioplasty and stenting, but we use groin, the blood vessels in the leg, to approach the heart, where the patient is actually conscious, and we map the electrical circuit inside the heart and thereby address the vulnerable and the disease-causing circuits, and the target is to eliminate atrial fibrillation. A recent state-of-art advancement would be cryoablation, which uses cooling and freezing the tissues which are responsible for atrial fibrillation and killing it. Unlike radiofrequency ablation, which uses heat as an energy source, but nonetheless, we have wonderful techniques these days to give us an exceptionally great success in patients with atrial fibrillation. So usually, medical treatment and catheter-based treatments, as mentioned, are complementary, and one side doesn't fit all. So patients derive benefit, accrue benefit from, depending on their stage and their underlying symptoms, we choose the modality.
Okay. Once you said that it's an interventional procedure, now the next question for the population would be, they will ask, what is the complication? You are going to do a procedure, what is the complication of the ablation?
Yeah, so unlike, any procedure, we all know and we've dealt with it, any cardiac procedure is not free from complication, the risk of complication. And complications do happen, and those complications can be minor to life-threatening, like a cardiac perforation, or you can have heart to esophageal fistulas, which can be potentially fatal. We can have debilitating strokes during the procedure. But that said, these complications in an experienced center with good volumes behind them, good operating techniques, and good numbers and experience, these complications are minimal, probably negligible. I mean, I don't think there is any high volume centers which repeatedly have these complications. That's less than 1%. They do happen, but I think in good centers who follow a mechanism, algorithmic mechanism and a certain protocol, we do not compromise the safety of the patient, and I think the complications are extremely low with great success.
Good. And you said after AF, how to treat? As you said, as the age advances, the AF increases also.
Yeah.
Is there any ways to prevent the AF?
Yes, so it's a cliche saying, isn't it? I mean, prevention is better than cure, and it's so true in modern day and age, and AF is no exception. prevention is any time better than, it's not only AF, it's any disease, and same with AF, it's always better to prevent an atrial fibrillation by, the measures are the same, having good lifestyle practices in your younger half of the first half of your life, how active you are, what sort of diet you take, how proactive are you about your physical activities, how sensitive you are towards your blood pressure and diabetes control if you already are. If you are very aware of your numbers, diabetes now, if you're very conscious about your weight range, I think you have almost done a lot, almost 90% I would say, to avoid or prevent anything. Bad things do happen. I mean, we can have things which we cannot explain, but I think if we can, I think we can do things which are there in our control. We go a long way in avoiding or preventing not only atrial fibrillation, even a heart attack for that matter, or hypertensive cardiac disorder, and all these things can keep us away and free from cardiac ailments for a very long time. Sleep apnea, like I said earlier, pointed out, somebody who's snoring, it's something which is grossly underrated. It's a complication of obesity. Now, obesity now is slowly and surely becoming a fundamental part of any cardiovascular illness, and once that is addressed, I think a lot of our physician related work gets easier.
Good. And now you have told about AF. Now can you tell us about what are the works you have done? Lot of complex interventions.
Yes.
Can you tell something about the patients? What are the ablation things we are doing in our center?
Yeah, so as an electrophysiology unit, first of all, I'm proud and privileged to be a part of this platform and this family of Apollo, which give us the next, it's the state-of-art infrastructure that we are in, the extremely well-trained faculty and the team of nurses and technicians. It's really a pleasure to be here, and the job is so much easier. And as far as the procedures are concerned, the technology, we have almost everything under one roof, where we do simple ablations, complex 3D guided ablations. Cryo ablation of atrial fibrillation is on its way. We can merge, we have sophisticated imaging techniques where we can merge images from CT and MRI with our mapping images, and then get great results out of it. Similarly, in interventions, we have state-of-art interventions, you name it and we have it, valve interventions, complex coronary interventions, and I'm proud that the results that we have been delivering for years have been exemplary, and we just, with your blessings and your support, will continue to deliver the same.
One final question, what is the cost involved in the ablation?
Yeah, again, it's a common question, isn't it? I mean, the patients eventually come and get worried about the costs. Atrial fibrillation is among the complex arrhythmias. It's not easy to ablate an atrial fibrillation with a simple unit. We need complicated or sophisticated catheters, which are not manufactured in India. They're often taken import from abroad, and these catheters are expensive. So 3D mapped RF ablation for atrial fibrillation would probably cost us anywhere around 4 to 5 lakhs. When we talk of cryo ablation of atrial fibrillation, which is probably a notch above, would cost us somewhere around 6 to 8 lakhs, I think.
Okay. So we have heard a lot about atrial fibrillation. Do you want to tell any message to our people?
Yeah, so I think the message would be, do not, if you have any of these symptoms that we have already discussed, or you have already suffered from atrial fibrillation or suffering from symptoms, I think there's no need to continue suffering, because be mindful that with each passing day you not only are punishing your heart, which is now functioning under a lot of mechanical stress, as we have discussed, but it's also that we probably are attracting a sort of complication of atrial fibrillation at some point. So it's important to get the best possible treatment, be it medical, be it procedural, and be at the best of shape, and allow your heart to be at its best or functioning at its best, so that if your heart lives longer, you got to live longer. Now, so take care of your heart, and you will get to live longer and better. We are at your disposal. We have all sorts of treatment at Apollo, the entire spectrum. Feel free to get in touch with the link that we provide. We'll provide you with the phone lines and the link. You can get in touch anytime. We are 24/7 at your disposal. And of course, do not forget the last line, which is prevention is always better than cure. If you do not have atrial fibrillation, that's great. Please take care of your high blood pressure, diabetes if you do have. Your weight is extremely important. Please be aware of what is your weight, the range that you should be in, and you should not be weighing more than that. Have a very, very proactive and healthy, physically active lifestyle. Do not become sedentary, especially our software peers who have long hours in front of system, and sleep well, and I think you will all do well. Thank you.
So, Dr. Soumen, it's very pleasure that you have enlightened in a very simple way to the public about atrial fibrillation. We are very happy that people will get benefit from it. And you can consult Dr. Soumen 24/7 in Apollo Hospital, Jubilee Hills, and he will give the best care to my knowledge. Thank you, sir.
Thank you. Thank you, Rufus. Pleasure. Thank you. Thank you.